Have you been experiencing SI joint pain? And maybe you've been to physical therapy and you've been doing all of the exercises, but it just seems to be so troublesome. We're going to dive into 6 different causes and solutions for SI joint pain today. So please join in. Hi, my name is Dr. Ariane Missimer. I'm a doctor of physical therapy, registered dietitian, and owner of the Movement Paradigm Integrative Health Center in the Philadelphia area. And I am super excited to talk about the SI joint because I personally had SI joint pain for so long and I got all of the wrong advice. So I think it's really important to understand it at a deeper level and all of the components necessary to really maximizing your treatment and ultimately being pain-free so that you can thrive. So what is the SI joint? So when we're looking at the pelvis from the back, we want to think about the bones, of course, is the sacrum, which is this triangular bone, and then we have the iliums on each side, so the pelvic bones. We have all of these different ligaments that are attaching from here to here. We have the sacrotuberous ligament, the sacrospinous ligament. We have ligaments that are even behind, and that is what is creating this force and form closure on the SI joint. Where we typically have pain is going to be right back here. So when you feel in the back of your body and you feel those kind of bony bumps, that's oftentimes where that SI joint will present, but it will also present in different areas around the pelvis as well. The SI joint is considered a very stable joint because it has a self-locking mechanism. We refer to this as a form-force closure. So it depends on the amount of forces that are coming into the joint. So if it's a vertical load, we're going to create stability through form, but it also is creating stability through different forces being transmitted through the joint as well, which we'll get into in just a moment. Let's get into the 6 causes of SI joint pain and what you can do about it. Number 1 is asymmetry. So this is no surprise, but most of you that have had SI joint pain know that often it is on one side. There are exceptions to every rule, but most often it is unilateral. And that is often because we are asymmetrical beings. So our anatomy drives extreme differences side to side based on where our organs are, where our liver is, where our pancreas and our spleen is. All of the anatomy in our viscera is asymmetrical. And so therefore we can create these patterns. And then if we add on top of that our day-to-day activities, so we always write with our right hand, or we're driving with our left hand, we cross our legs over to the right. This creates these asymmetries, and there's very common patterns that this can cause based on our anatomy plus our movement compensations during the day. A lot of times what can happen is we create changes in the diaphragm, specifically in our respiration. This is going to affect how our whole integrated unit of stability is working. And then oftentimes what will happen is in this cross pattern, oftentimes with the right leg, the hip will start to internally rotate. So it makes it not as strong on that external rotation. So sometimes our glutes aren't working as well and so on. And so when this happens and this pattern starts to happen repeatedly, then we can create pain in the SI joint. Number 2 is our force transfer. So when we are having, let's say, these asymmetries, and now we are moving through the world, we're taking in potential energy every time we strike the ground, and we're releasing that as elastic energy. So how we're using the force from the ground as this energy in our body is going to be through our force transmission system, i.e. our fascial tissue. So that's that 3D network. I talk about that a lot. That is our glue that holds us all together. Won't get into all of that right now, but one of the things we want to think of is the deep longitudinal line. So this is a fascial system is part of our body that starts all the way from the outside of the lower leg. That's called the fibularis. Then it goes up to the outside of our hamstring. It goes up to our external rotators in our hip. It goes into the ligament, one of the main ligaments, the sacrotuberous ligament of the SI joint. And then it goes all the way up towards our low back muscles and in that fascia in our low back and mid back. And so this is a huge area where we transmit force. And if there are any compensations in this area, any muscular imbalances, for example, if we have really flat feet, and we have really tight lower leg muscles on the outside, those perineal muscles, those are really tight, then that is going to affect the entire fascial line, potentially contributing to SI joint pain once again. On the other side of that is that we need optimal stability, reflexive stabilization particularly, from our deep front fascial line, and that starts again at the bottom of the foot, in the inside of the foot this time, comes up behind the knee, goes up to the inner thighs, goes up to the pelvic floor and the diaphragm and the deep stabilizers of the hip, and all the way up to the neck and even the tongue. So this deep stabilization system is critical for optimal SI joint mobility and stability. And so even though it has this self-locking mechanism, it's a stable joint, we need to make sure that all of the musculature around it is stable so that we can have optimal force transfer. That leads me right into number 3, which is foot position. So we can have issues in the SI joint in either foot position, either extreme. So if our foot is overly everted, so turned in, versus overly inverted, or we could say high arched foot type, either one can put stress on the SI joint for different reasons. If we are rotated in, flatter foot type, then we might not have that deep stability to ultimately generate force properly. If we are externally rotated, we're actually putting a lot of stress on some of those SI joint ligaments and creating stress on the pelvis. So this can also be a factor in creating potential pain. So we want to work towards bringing our foot to neutral position. That can look like working on mobility and or stability in the feet to bring balance to the lower leg. Number 4 is breathing. So you've heard me talk about this before, but when we are breathing properly, we want to think about the position of the diaphragm. So if this is our pelvic floor, we want to have our rib cage positioned over top of the pelvis. This is really we call this a stacked position, and it also is referred to as a zone of apposition, which allows the diaphragm to be in its best position for it to be able to communicate efficiently with the pelvic floor. Because if not, what happens is we can be in this kind of open scissors posture where the pelvis is tipped down and the rib cage is tipped up. So we're kind of extended or arched, and this can create a whole host of issues and compression on the SI joint. So how do you improve your breathing? Think of tongue at the roof of your mouth, breathing in through the nose, allowing the abdomen to expand completely, really trying to optimize that 360 breath, and then exhaling, abdomen contracts. You want to do this from a stacked position. So I always like to say, bring your hands on your rib cage, breath in, exhale, ribs down, and then breathe from that position. Number 5 is pelvic mobility. We talk so much about stability, which is so important, and I could talk about it for days. We want to also think about how the pelvis moves, especially during gait. And when we have SI joint issues, it is not only that it's a stability issue. A lot of times it's a mobility issue. We want our pelvis, especially when we're thinking about gait, we want our pelvis to move forward, backward. We want our pelvis to rotate, and we want our pelvis to side bend. We need all of those motions to be very free and fluid for optimal movement. So this is something you can do while you're lying down, and you can put your hands on your pelvis and just guide that motion with your breath. Inhaling, exhaling, moving and coordinating it with that subtle movement to begin to really restore some natural fluid movement in the pelvis, which many of us have lost. And last but not least is integration. So as I mentioned, we not only need stability, so sequencing, timing, coordination with our breath, with our foot position, with our ability to keep the ribs in an optimal position, addressing these asymmetries so that we can bring balance to the diaphragm and the respiration so that we don't have these abnormal forces through the SI joint. But now we need to bring it all together. And so the best way to do that is through an exercise called short foot. So for short foot, you might have seen this in lots of other videos, but what we'll have you do is step with one foot forward, the other foot slightly back. So you have a little bit of a kickstand here. You're hinged over at the hip. Okay, so I'll just turn to my side here. So you're thinking of hinging this way. From that position, you would take your breath in through your nose, And as you exhale, you're going to gently root the tips of your toes into the ground. Breathe in, tongue at the roof of your mouth. Exhale, rooting the tips of the toes into the ground. If that feels easy, you can come up into a single leg stance. And there's lots of progressions to this, but this is a beautiful way to integrate the reflexive stabilization from your foot. You're doing it from a neutral foot position, as we talked about today. You're working on your breath. You're working on all of these deep stabilizers. It's a great way to integrate all this together and then can move into more dynamic patterns where now you start to work on the stability and mobility of the pelvis that we need for optimal movement and efficiency.